Okay, what do I want you to focus on for day 14? Um, we had a bit of a gap, so we had a bit of a gap for the past 2 days, but I'm going to kickstart again at 8 p.m. Day 14, I want you to focus on introduction to the genitourinary system, so entirely the genitourinary system. It's a medium weighting chapter. I want you to know about medications that are used for urinary frequency, incontinence, and nocturia. Go through antimuscarinics, go through beta 3 adrenoreceptor agonists such as mirabegron. Want you to go through desmopressin, summarize everything that you've learned in that, go through combined oral contraceptives, the progesterone only pill, emergency contraception, erectile dysfunction, alpha blockers, 5 alpha reductase inhibitors, and vulvovaginal infection. So this, I want you to go through the genitourinary chapter in this on this day. I also, so if you're not a member, if you're a member, you got access to all of those videos. If you're not a member, go through it in accordance with the BNF content. And I'm going to end this video with a quiz night that I have previously delivered. So you can go through those questions, see how you perform in those. Okay, so which of the following is a common side effect of olanzapine that the patient should be monitored for? Just bear with me about that. Okay, let's go through this question. With regards to, so the patient's 32 years old, has been prescribed olanzapine. So the correct answer for this question is weight gain. So weight gain is a well-known side effect of olanzapine. Patients that are taking olanzapine should regularly be checked for weight gain. With regards to the other adverse effects, they are not adverse effects that are particularly monitored for olanzapine. Is there any other agent that you would monitor for agranulocytosis? Yes. So with regards to the clozapine is where you would monitor for agranulocytosis. Which of the following medications is primarily used to manage motor symptoms in Parkinson's disease by directly stimulating dopamine receptors? Stephanie, it's just the locator locum link that I've sent. You just have to sign up. It's just one form that you have to sign up for. And if you ever use locator locum, then you get £40 for working your first shift. So I'll share the link in a second. Let me just, I've just got the rationale for this question, and I'll share the link again. So the correct answer for this was D, pramipexole. The reason for that is pramipexole is a dopamine agonist that directly stimulates dopamine receptors. Carbidopa is a drug that blocks the conversion of levodopa to dopamine outside of the central nervous system. So here you're looking for a dopamine agonist that's directly stimulating dopamine receptors. I've popped the rationale in the chat as well. Which of the following medications is primarily used to manage motor symptoms in Parkinson's disease by inhibiting the enzyme monoamine oxidase B? Let me pop the links in the chat. The easiest thing to do as well, Stephanie, is if you're signing up today, once you've signed up, just get a screenshot of the sign up page. Once you've signed up, it'll show you like your profile, and send that over to me at info@micropharm.org. Just means that I don't have to wait for Locator Locum to send me a confirmation list tomorrow. I can send it immediately tonight. Okay. Let's go through this question. So the correct answer for this was selegiline. Selegiline is a selective inhibitor of monoamine oxidase B, and it helps increase the levels of dopamine in the brain and manage the motor symptoms of Parkinson's disease. Okay. Let's relaunch the poll. Patient is diagnosed with C. difficile infection. Which of the following is the first-line treatment for this condition? I'll make your life easier. It is not life-threatening. Thank you, Ashley. Okay, let's share the responses from this, because we've got about 85% of you have voted so far. So 94% have put oral vancomycin. This is fantastic because I've been going on about this for a few weeks now. So let's go through this in a bit more detail. C. difficile. If it's mild, moderate, or severe, what's the first-line treatment? Mild, moderate, or severe, what's the first-line treatment? Oral vanc. It's the same for mild, moderate, and severe. Is it ever oral metronidazole? No. So nationally, it's been removed from the guidance. It's been removed from the NICE guidance. It's been removed from when you see it in the BNF as well. Reason for this is all-cause mortality was less with oral vancomycin. Recurrence was less with oral vancomycin. So the decision was made to just remove it from the guidance because we've got better options. So first line is oral vancomycin. Second line is what? Let's say second line if they can't have oral vancomycin immediately. Oral fidaxomicin. So I know where the person's put the 7 weeks. So if it's within 12 weeks, what do we treat the patient? If a patient has another occurrence within 12 weeks, we give fidaxomicin. If it's post 12 weeks, we can give oral vancomycin or oral fidaxomicin. The reason why we can do both is we we treat something over 12 weeks as a recurrence rather than a relapse of that initial infection. So we're more confident that the oral vancomycin will work. If it happens within 12 weeks, it could be a relapse of that initial infection. And what we want to do is we want to use an agent that would hopefully be more effective. Another thing that's useful about fidaxomicin is it's a sporicidal agent. And what C. difficile can do, it produces these spores. So then you get rid of the bacteria and the spores still remain. So that way you can get rid of those spores as well. For anyone who works in hospital, just an interesting point, the reason why we say you can't, after managing or treating a patient or handling a patient with C. difficile, you should always wash your hands. Does anyone know why this is? Why can we not use alcohol gel? Nope. Back to what I was just saying. It doesn't get rid of the spores. Yeah, it doesn't get rid of the spores. So this is why if you're working in a hospital, always remember from infection prevention perspective, if you ever see someone handling a patient with C. difficile, they need to wash their hands before they leave that room. And generally, that patient will not be put in a bay because of the risk of them spreading to other patients. Okay, next question. Let's relaunch the poll. A patient with a systemic candida infection is prescribed fluconazole. Which enzyme does fluconazole inhibit to exert its antifungal effect? For anyone that is interested, Harry Kane just scored just a few minutes ago. No, no. I'm getting ready to get the rationale ready for you. I thought let me Google it. If I could put it in the in the corner of this page, I would. Okay, so let's share the response. So fluconazole inhibits the fungal enzyme cytochrome P450, and it specifically targets the enzyme lanosterol 14 alpha demethylase. By doing this, it disrupts the synthesis of ergosterol, which is important for the fungal cell membranes. Okay, let's launch the poll for this. Yes, that's correct, Omar. No, just both water and soap. Yeah, water and soap. Sorry, I thought you were. Is it both water and soap? Well, it's the soap that kills it, but you'd obviously use it. You'd wash your hands with water and soap. Okay, a 60-year-old woman with hypothyroidism is being treated with levothyroxine. Which of the following symptoms would suggest that you've overtreated this patient? So you essentially provided this patient with too much levothyroxine. I'll go through it in a bit more detail, Adam, so you understand the risks associated when you're giving the when you're giving levothyroxine. So everyone has put down, the majority of you have put down D, palpitations, which is correct. So what you're trying to do essentially with a patient with hypothyroidism is you're trying to replace you're trying to replace either T3 or T4. And by replenishing those stores, you can hopefully manage the symptoms associated with hypothyroidism. If you do have hypothyroidism, does anyone know what sort of symptoms a patient may present with? Weight gain, cold intolerance, bradycardia in particular, and constipation. And patients with hyperthyroidism, so easiest way is everything's slower. And that's like with regards to your metabolism as well. And that's what leads to when someone says, I have a high metabolism, best way to remember it, when someone says, I have a high metabolism, therefore I don't put on weight. It may be true, it may not be true with that individual, right? But it makes your life a lot easier when you're remembering what happens in association with it. So the correct answer for this was palpitations, Ashley. But the reason why palpitations is what's happening in hypothyroidism, everything's slow. So if you're overtreating with levothyroxine, this patient, you can lead to a patient having hyperthyroidism, right? Um, and with associated with hyperthyroidism is weight loss. Patients will have heat intolerance, the opposite. They'll start to feel really hot. They may have palpitations. And if you overtreat, particularly for a prolonged period of time, it can actually lead to arrhythmias as well. And then quite often, if a patient has hyperthyroidism, they have diarrhea as well. The other thing to add to that is this is quite often why we are taught to be mindful of the fact that patients can actually abuse levothyroxine if they want to lose weight. So there's definitely there is a problem with people abusing levothyroxine in order to lose weight. But of course, that comes with lots of other risks associated with palpitations, arrhythmias. But that's something to be mindful of. Yeah, so can I explain so when patients are on levothyroxine, I'll show you uh, the section in the BNF as well. When patients are being managed for being treated with levothyroxine, one thing that's important is that they have a baseline ECG before starting treatment if they have cardiovascular disorders. And the reason for this is because of the fact that if you lead to the patient having hyperthyroidism and if you overtreat them, it can lead to arrhythmias. I'll show you the section with regards to monitoring as well. No, so someone sent me a private question. I thought levothyroxine would gain weight as it's used for hypo. No, so patients tend to gain weight when they have hypothyroidism. But once you start to treat with a levothyroxine, that the problems associated with hypothyroidism, which include weight gain, should resolve. They shouldn't have that problem. But then if you overtreat with levothyroxine, it can lead to them having hyperthyroidism, and then they can start to lose weight. Okay, let's relaunch the poll for this. Yeah, just to add to that valproate question, people are right. So valproate, there's a update from the BMJ that says sodium valproate should not be started in patients, whether they're male or female, under the age of 55, unless two specialists agree and there are no other options or any compelling reasons uh, that the reproductive risks do not apply. For myoclonic seizures, if a patient is not of, I just added that. For myoclonic seizures, if a patient's not of an age where there's reproductive risks, then levetiracetam. So I've just added that for that. For the thyroid question, so we monitor for hypo for palpitations, um, and for hypo for QT. Let me double check. We would advise patients and we look out for palpitations and signs, but let me see with regards to monitoring with. Yeah, so key things that you're monitoring for hyperthyroidism is palpitations, possibility of causing atrial fibrillation, and also increased cardiac output. Key things that you're looking out for hypothyroidism, bradycardia, can cause QT interval prolongation as well. Okay, let's share the responses from this. So sulfonylurea is the most common side effect associated with it. And what you want to be mindful of is a possibility of causing hypoglycemia. The reason for this is that sulfonylureas increase insulin secretion, and therefore, as a result of this, can increase the risk of hypoglycemia.